All right, so we know that several studies have shown that increased mammographic breast density is now considered a moderate independent risk factor for breast cancer. The odds ratio for developing a breast cancer when comparing less dense to more dense breasts in these studies have ranged between 1.8 and 6, with an average of 4 of an odds ratio. So there is data on the relationship of race and mammographic breast density. However, there's a dearth of information on the relationship between breast and MRI findings, such as density, background parenchymal enhancement, and fibroglandular tissue. And that was the purpose of this study, to evaluate the relationship of race with these MRI findings in a contemporary cohort of women with breast cancer. We used the NYU Medical Center breast cancer database for the study, and what's interesting about this database is that the patients that we collect into this database are, though racially diverse, mostly college educated, above the poverty line, have health insurance, access to health care, have had a mammogram in the last year, a clinical breast exam. So a lot of the confounding factors we have in studies looking at racial disparities are eliminated just by virtue of the population that we capture, which I think is interesting is unique to our database. So a total of 2,092 women were in the study with a median age of 59. The majority of these women, like I said, had had an annual mammogram, clinical breast exam. Most presented with an early stage cancer, 0 or 1. Most had invasive ductal carcinoma with ER/PR positivity and HER2 negativity. So when looking at the MRI findings, when compared to Caucasians, African Americans had lower breast density, lower background parenchymal enhancement, and lower fibroglandular tissue. However, they had a higher BMI. Asians had pretty much the exact opposite. They had higher breast density, higher background parenchymal enhancement, higher fibroglandular tissue, and a lower BMI, which makes sense when you think about it. A lower BMI, you're going to have a less fatty breast and a more dense breast. We also found differences among races with respect to the tumor biology, with African Americans having a significantly higher rate of triple negative disease and further stage, which has been shown time and time again in studies. However, this did not translate into a higher breast density on MRI imaging. So the differences in imaging characteristics are likely accounted for by this difference in BMI and fat content of the breast. However, it may not be directly related to breast carcinogenesis and tumor biology. So we concluded by saying that further research needs to be done to elucidate the pathophysiology and biological mechanisms underlying the relationship between BMI, obesity, and the types of breast cancer that we're seeing in women.